Hey everyone, we have Dr. Cedrek McFadden with us. He's our 70s medical consultant, and he's helping us navigate Halloween. It is just around the corner. A lot of people are wondering how they can trick or treat and do it safely, or at least try to make it safer. Dr. C, is that possible?
It is possible, but it has to be sort of a mentality shift of what we think about the traditional walking as a group to a door, multiple doors, knocking or ringing a bell. So you're touching an item that many people are going to be touching that same day. Perhaps even you're reaching into a basket where other people have reached, and you're touching items that other people have touched. You're placing that then in your own pocket or basket, and then you're perhaps eating some of those products. And so you have to do a paradigm shift of what you traditionally think about. When we think about trick-or-treating this year around, we should probably consider individually wrapped goodie bags that are placed away from the door, perhaps at the edge of the driveway, edge of the yard, where people can walk by wearing masks, keeping socially distanced, grabbing those items, and just celebrating in that capacity instead of sort of that interaction that you should traditionally have at someone's door.
And that's the bummer, isn't it? Because we all look forward to those moments where we finally see the neighbors' kids growing up like year after year. But this is
Yeah,
just maybe not the year to worry about that kind of thing for the health
correct.
priorities that we have to have. What about what the activities are that might be lower risk?
Well, you're outside in many of the activities, which is a great thing. Outdoor, open spaces, and keeping that distance between each other. And one of the things that many people have considered doing were pumpkin carving contests between members of different families where they're spaced out. People are still decorating their homes. People are still wearing costumes, doing plenty of virtual activities. Again, that is perhaps the safest option. You could also consider doing movie nights within the neighborhood where you have space between families that can, allow them to interact and share in the festivities.
And what about the activities that pose the greatest risk? I mean, what do we need to be aware of?
Well, often we think about haunted houses, we think about costume parties, indoor events. Those are perhaps the greatest risk, especially if you're going through an indoor haunted house where there's lots of screaming going on. We know, and we've talked about before, that this virus may linger in the air, so that's particularly high risk. And any crowded indoor party is a high risk. This is not the year to go bobbing for apples. This is also not the year to go to other neighborhoods or communities you're not a part of and participate in their activities. All of those types of interactions may increase your risk for COVID-19.
And that kind of brings us to this question, which is, your social bubble, right? We've all sort of had some folks that we've sort of gotten together with or kept sort of in that bubble of controlled exposure. And now people want to kind of creep out of that. Can we expand the social bubble?
So you can, again, think about going outside, think about doing things. There's nothing wrong with having a costume party outside or having even a costume parade outside, allowing that distance, or again, having a movie night. Now, I would caution you that if you are having a movie night and it's a particularly scary movie and there's going to be some screaming involved, you want to increase that distance from 6 feet to perhaps even 10 feet between the patrons who will be participating in the event. There's also nothing wrong with going through mazes or doing a single way sort of haunted forest event. But those things, again, keeping the distance, especially if they're screaming, which sometimes you can't anticipate, and it sometimes happens organically just because your senses are heightened during those events.
And what about the rules surrounding masks this Halloween?
So you should make a mask a part of your costume. We're talking cloth masks. Now, costume masks do not substitute for cloth masks. The ones that we've probably grown up wearing. But you should also remember that you should not put a cloth mask on top of a costume mask, as that could create breathing problems. And as always, as we said along, children under 2, be very particular and cautious about the mask you place on them, because they may not be able to inform you that they're having breathing trouble if that is indeed the case. But continue to wear the cloth mask, make it a festive part of the costume. Don't substitute the costume mask from that one.
Dr. Cedrek McFadden, thank you for your expertise. We appreciate it.
Thank you.
As we head to